All right. Um, Again, good afternoon, everyone, and welcome to today's webinar, an introduction to environmental assessments and the role for public health. This is a third in a four-part webinar series, and today we're exploring this work through a road improvement project case study. My name is Lorenzo Mele, and I work with the Region Appeal as an advisor on healthy design, a bridge between public works and public health, and I'll be the moderator for today's session. The webinar is being hosted by the Ontario Public Health Association's Built Environment Work Group, which I'm a proud member of. And the OPHA is nonpartisan, non-for-profit charity that brings together a broad spectrum of groups and individuals from various sectors, including public health, healthcare, academia, nonprofit, and the private sector. OPHA's mission is to provide leadership on issues affecting the public's health. OPHA offers professional development, such as this webinar, information and analysis on issues affecting health, and advocacy and consultation on healthy public policy. Being a member of OPHA is an excellent way to build a network with other like-minded professionals, and if you're not already a member, I encourage you to join. The Built Environment Work Group is one of several OPHA work groups that respond to public health issues of provincial interest. One of these issues that we identified through a 2017 survey of Ontario public health units was that there was an interest in engaging in the environmental assessment process, specifically related to transportation and roads. But there's also an acknowledgement on the part of the respondents with these public health units that there's limited knowledge on how best to do this. And so this has prompted us to put together the webinar series in an effort to to build some capacity internally. The knowledge building, again, the webinar is a good example of this, and then this upstream integration of public health in the EA process itself. Today's webinar objectives really to appreciate the merits of public health participation with review of the terms of reference for environmental assessments, providing input to the scope of work at the beginning and during key stages of the study. We're going to learn how conducting a physical walk route with members of the community enhances public engagement, and understand how the use of something specific like a walking audit assessment tool developed by Peel Public Health is helping with decision making by identifying these areas of opportunity and concern from the public health perspective. Today's webinar will be recorded, and the presentation will be made available online. All of the participants, as I said before, are muted. But I invite you to participate by using the chat function on your screen. Feel free to ask questions or add comments, and I'll pose questions to our presenters during the Q&A time after the presentations. To get us started, we've got a few short questions for you to learn a little bit more about you and your sort of understanding around the EA process. And if I could have that poll up now. So the first question, have you ever participated in any kind of environmental assessment? Simple answer, just yes or no. And we'll give a few moments for people to respond. Just a few more moments here. And we can see that there's roughly a 50-50 split on, have you participated in any kind of environmental assessment in the past? So one of the reasons why we're doing this. Have the second question, please. So the second question, what's your current level of knowledge about the environmental assessment process? And just a scale from very high to very low. Again, a few moments to respond. Thank you for that. And as you can see, there's generally a moderate to low understanding of the process. So again, reinforces why we're doing this work. Can I have the third and final question, please? And what types of EA consultations, for those of you that have been participating, do you see being most relevant to your work in public health? Okay, so the vast majority of people are interested in transportation, road type EAs. In our experience, those are the majority of the EAs that we do see. However, an acknowledgement that the EA process, of course, is designed to address other types of undertakings, including waste management, water treatment, and so on. So that's important for us to not lose sight of as we do this work on environmental assessments and how best to include the health impact. Okay, thank you very much for indulging us on that. It gives us an indication of where people are with their knowledge base, and it allows us to sort of develop other initiatives. Okay, so yes, thank you again. And at this point, what I'd like to do is I'd like to introduce our presenters and my colleagues from the Region of Peel in Public Works and Public Health Departments. First, I'll start with Sonia Bubash. Sonia is a registered professional planner. She's a project manager with our Transportation Infrastructure Programming and Studies group within the Region of Peel Public Works. Sonia is currently managing the Class EA study for improvements to approximately 7.5 kilometers of airport road in Caledon, one of the communities in Peel Region. And Sonia has over 20 years of experience combined with public and private sector work, primarily in Class EA studies for transportation projects. Welcome, Sonia. And Cale McMillan is a health promoter on the active living team of health services, chronic disease injury prevention with the Region of Peel. Cale's work focuses on active transportation and active living in Peel, and she is the project lead for Peel Public Health's Walking Audit program. Cale has been working in the area of health promotion and public health for the past 7 years. She has a Bachelor of Science in Kinesiology from McMaster University and is currently completing her Master's of Public Health from Waterloo University. Welcome, Cale. And with that, I will pass the presentation on to Sonia, who will lead, and then Cale will follow. Please go ahead.
Thank you, Lorenzo, and hello to everyone. Thank you very much for this opportunity to participate in today's webinar. In addition to Cale and myself, I should also mention that we have Michael Bennington from Public Health on the line to assist with any questions you may have at the end. So the purpose of our presentation is to share how public health input is incorporated into a road improvement EA at the Region of Peel. For the purpose of this presentation, we will focus on a case study, that is the Airport Road Class EA. We'll give you an overview of the planning process, health impact considerations, and consultation, specifically a method called the Walking Audit. I should note that the environmental assessment is a work in progress. So the information provided is focused on inputs rather than outcomes. And this is because we have not yet completed our assessment or presented some of the findings to date to the public. But if you are interested, you can monitor the study's progress on our project website, and the address can be provided following this webinar. So to begin, we are currently working on an environmental assessment, and we normally are quite often just coin it as EA. We're working on an EA study for improvements to Airport Road from King Street to Huntsmill Drive in Caledon, if any of you are familiar with the area. Airport Road within these study limits is a 2-lane regional road serving local, through, and truck traffic for a distance of approximately 7.5 kilometers, as Lorenzo already mentioned. This section of road provides access to the communities of Caledon East, which is generally surrounding Old Church Road, if you can view the map, and Mono Road community, which generally surrounds Old Baseline Road. So to give you an overview of the study area, the surrounding land uses range from rural and agricultural at the south end to residential, commercial, and institutional throughout, and then to some natural areas at the north end. And these land uses include a school, places of worship, and several businesses, such as cafes and stores, predominantly within Caledon East and Mono Road. As well, there is a recreational trail that crosses Airport Road just south of Old Church Road. Our study follows the requirements of the Municipal Class Environmental Assessment. This is a process by the Municipal Engineers Association that was last amended in 2015. The initial stages of the study justified the need for the project and developed the following problem and opportunity statement. So our problem or objective is to improve the corridor. Improvements are required to better accommodate all uses in the corridor, including vehicular traffic, goods movement, walking, and cycling, to improve safety and support local communities. To address this problem and opportunity, the study examines intersection improvements to address future capacity constraints. Currently, the study is not looking to widen the road for additional through lanes. The study also examines traffic calming measures to slow traffic, including truck traffic. So although Airport Road is a goods movement corridor, truck traffic and speed are major concerns in Caledon East. And the study examines active transportation infrastructure to support and encourage walking and cycling. This Class EA study is managed by the Transportation Division in Public Works. Public health is a key stakeholder and is involved throughout the EA process. So prior to commencing the Class EA study, Public Health is invited to participate in developing the work plan by reviewing the terms of reference. Public Health is also invited to participate on the Technical Advisory Committee to provide input at key stages of the planning or decision-making process. There are 5 planning and design phases in the Class EA. This slide shows the 4 planning phases and the type of input provided by Public Health during each phase. The slides that follow will provide more detail on the contributions by Public Health. So phase 1 identifies the problem and opportunity to be addressed in the study. For Airport Road, Public Health suggested the team pilot a multimodal level of service analysis to determine the condition of existing infrastructure and opportunities for improving infrastructure for both pedestrians and cyclists in addition to vehicles. And the outcome would contribute to a problem statement. Phase 2 identifies and evaluates alternative planning solutions to the problem and opportunity based on an assessment of impacts to the natural, social, cultural, and economic environments, and subject to consultation with the public, technical agencies, and Indigenous communities. The outcome here is a preferred solution. In our case, the preferred solution is to improve traffic operations, traffic calming, and active transportation. Phase 3 identifies and evaluates alternative design concepts to implement the solution. Again, the evaluation is based on an assessment of impacts to all aspects of the environment and is subject to consultation with the public, technical agencies, and Indigenous communities. The outcome is a preferred design concept. Currently, our case study is considering the options of conventional intersections or roundabouts and multi-use trails or cycle tracks with sidewalks through parts of the corridor. So during phases 2 and 3, Public Health provided a set of criteria to assess the impacts of these alternatives on community health. And this was considered in the evaluation of alternatives under the EA category of social environment during both phases 2 and 3. Also, Public Health conducted a walking audit with the community to gather feedback on the walkability of the study area, which would contribute to a detailed inventory of the transportation environment during Phase 3. Phase 4 documents the planning, design, and consultation process in an environmental study report for public review. The report will describe the preferred design and mitigation measures to address potential environmental impacts. Public health is invited to review all relevant documentation prior to public review, such as the air quality assessment report. And Phase 5 is the detailed design and construction stage, including environmental monitoring. This phase follows study completion and is therefore not included on this slide. Next, let's take a closer look at the input provided by public health and how it is incorporated into the EA. And we can start with the multimodal level of service analysis. The multimodal level of service guidelines prepared for the City of Ottawa were used to pilot the analysis for existing conditions on Airport Road. And the City of Ottawa guidelines define multimodal level of service as a set of discrete quantitative measures used to describe the convenience and comfort experienced by all roadway users over a particular roadway segment or a particular intersection. The multimodal level of service analysis measures the performance of all travel modes and not just vehicles and sets target performance measures. For this EA, IBI Group was retained by the region to complete technical studies and completed this analysis. They completed this analysis for existing conditions. The analysis for future conditions was not completed, partly due to scope limitations as the concept was incorporated after the terms of reference was set, and partly due to the region's ongoing interest in developing its own multimodal level of service methodology. The analysis for future conditions could be incorporated into future environmental assessment. Nevertheless, the results assisted in justifying the need for improvements and were generally described to the public as existing conditions and opportunities. So I won't go into the details of the analysis at this time, but I will show you a couple of slides that capture how this information was presented to the public during the study's first public meeting. This slide describes the existing conditions, highlighting that there are poor sidewalk conditions currently on this section of Airport Road. We see gaps in sidewalks between communities, and there is a lack of cycling facilities. There is a challenge on Airport Road, and that is the constrained right-of-way. There's currently, in some parts, there are currently limited space for improvement, for active transportation and other road improvements. Under opportunities, we note that enhanced active transportation facilities are supported by both the Town of Caledon and Region of Peel. This slide shows the existing pedestrian and cycling environments for sections of Airport Road and conveys what to consider when designing improvement for pedestrians and cyclists, which is based on the design requirements of the multimodal level of service guidelines. So for example, considerations for the convenience and comfort of pedestrians might include boulevard width to provide an adequate buffer between pedestrians and moving vehicles, a shorter crossing distance at intersections for convenience, the presence of on-street parking to slow traffic, although opening doors of parked cars could also be considered as a potential hazard for cyclists, sidewalk width for accessibility, and signal phasing and timing. Considerations for the convenience and comfort of cyclists include the availability of bicycle lanes and facilities, designing right turn lanes to enable motorists to see and anticipate cycling movement, and designing staged left turns for cyclists. In addition, we can also consider things like cross rides at intersections. A cross ride is essentially a crosswalk where cyclists can ride across rather than dismount at intersections and at crossings. So in the end, we have a focused understanding of existing active transportation conditions and the ways in which road design could help enhance the corridor for pedestrians and cyclists while maintaining safe travel for all road users. Next, we will share the criteria provided to assess the health impacts of alternatives. The Healthy Community Assessment includes 3 evaluation criteria. The first criterion considers whether the alternative reduces the risk of chronic conditions through active transportation. So as examples, this criteria can be measured by continuous active transportation infrastructure or the separation between the roadway, pedestrian infrastructure, and cycling infrastructure. The second criterion considers whether the alternative supports an age-friendly environment. This criteria is measured by the ability to enhance accessibility of the roadway for all road users. And the third criterion considers whether the alternative reduces the risk of respiratory and cardiovascular outcomes associated with exposure to traffic-related air pollution. This criteria is measured by the degree to which this design plan or the alternative meets provincial criteria for air quality, or to which negative impacts can be mitigated. It is worth noting that the criteria are a starting point to be reviewed and applied in the context of the environmental assessment. For Airport Road, some criteria were removed from the Health and Community Assessment due to overlap with other environmental assessment criteria. So for example, operating speeds are considered under the transportation criteria, and air quality is considered under the natural or social criteria. Some criteria could be removed based on relevance to the study area. For instance, transit prioritization may not apply if there is no current or planned transit on this corridor. This slide shows how public health proposes that health impacts be assessed and evaluated. So again, for example, if we look at the continuity of active transportation facilities, the scenario in green is most preferred, the scenario in yellow is moderately preferred, and the scenario in red is least or not preferred from a healthy community perspective. The most preferred is a road design that provides a continuous active transportation facility along the length of the corridor and connects to the existing network. So if you have a bike lane or a cycle track or some type of multi-use trail, the idea is that it be continuous through the whole segment, the whole corridor, and that it connects to the network beyond the corridor. The moderately preferred is one that provides the continuous facility along the study corridor only and doesn't necessarily connect outside of that. And least preferred is the one where either no contribution to the active transportation network is there or the contribution is segmented throughout the corridor. So as another example, for separation of facilities, most preferred is the design that provides a physical barrier or a wide separation between the sidewalk or multi-use trail and the roadway is supplemented with trees, bollards, or planting strips. So the idea here is to provide that separation for comfort and safety. Moderately preferred is one that provides the same separation without the trees, bollards, or planting strips, so without the extra. And the least preferred is the one that either provides a narrow separation or no separation at all. This slide is a continuation and shows the multimodal level of service as a measure or indicator. So as mentioned, we did not complete a multimodal level of service analysis for future conditions on Airport Road, and this could be considered in future environmental assessment. But if there were to be a performance target in terms of what level of performance you would like to see cycling and pedestrians, you would like to see for cycling and pedestrians, that could essentially be included, incorporated in the evaluation. The last example I will highlight for this section is accessibility. Most preferable is a design that exceeds the design standards under the Accessibility for Ontarians with Disabilities Act. Moderately preferred is the alternative that meets the standards, and least preferred is one that does not meet the standards. In the end, the Healthy Community Assessment will be incorporated into our overall environmental assessment evaluation of the alternative design concept. Trade-offs may then need to be considered when evaluating against all the environmental assessment criteria, and perhaps this could be a separate topic for a future webinar. Here we introduce the Walking Audit tool developed by Public Health as a consultation method. There are mandatory points of contact with the public during the environmental assessment process. During Phase 2 to review the alternative solutions, during Phase 3 to review the alternative design, and during Phase 4 to review the environmental study report. The best opportunities for the walking audit are during Phase 2 or 3 to gather input on the problems, opportunities, and possible solutions within the active transportation network, or the alternative design concepts for new or upgraded active transportation infrastructure. And again, active transportation referring to walking and cycling facilities. Public Health conducted a walking audit for Airport Road during Phase 3 when detailed inventories are undertaken for the alternative road design. The walking audit was conducted with the Community Working Group on Airport Road. Similar to the Technical Advisory Committee that I mentioned at the very beginning, the Community Working Group was established to provide input at key stages of the EA study. The group is comprised of approximately 15 members who represent a cross-section of interests and are there to provide a balance of perspectives from the community. The walking audit was carried out in November of last year, and it was carried out in place of a meeting with the Community Working Group to provide for an interactive discussion. So why conduct a walking audit for the environmental assessment? The tool aligns with the public consultation program. It is a method for gathering input from the community, and it provides an experience for community engagement. The walking audit serves as an evidence-informed tool. The feedback can be used to inform planning and design, and feedback is both quantitative and qualitative. And Kayla will explain the difference shortly. The application builds cross-sector relationships, specifically between public health and public works. The tool can be used to achieve the consultation objectives of the environmental assessment and the objectives of the walkability program. So with that, I will turn it over to Kale, who can further explain why we consider walkability and describe the walking audit tool in detail.
Okay, thanks, Sonia. So this is Kale McMillan here, health promoter at Public Health. So I'm assuming that many of you listening are coming at this from a public health perspective, so this slide likely won't be news to you, but I think that it's helpful in setting the stage in terms of the health problem that we're looking at. So we know that only 22% of Canadians met the physical activity guidelines of 150 minutes per week. We know that sedentary behaviors are increasing, with adults spending on average 9.6 hours of waking time being sedentary, which contributes to things like type 2 diabetes, cancers, heart disease, and this can be likely a result of a variety of factors in our society. So it could be things like we have more sedentary jobs, we have higher screen time use, we use less active transportation, and there's more auto-oriented built environments. So I always like the example just on the bottom left-hand side of the screen of kind of a key auto-oriented built environment, which is an aerial shot of a kiss and ride program at a local school that kind of zigs and zags through everything that's very car-centric. So in terms of promoting walking, we know that it's shown to be an effective strategy for increasing physical activity levels. Something as simple as people who live in neighborhoods with sidewalks on most streets are 47% more likely to be active at least 30 minutes a day. We also know that walking is a popular activity. It can be incorporated into people's daily routines for transportation or for leisure purposes, and we know that it can be a realistic step for people that haven't been physically active in the past. Looks like, can someone just move forward my slides there? Oh, there we go, got it. Sorry, one sec. Okay, sorry about that. So in this part of the webinar, we're really going to go into more detail about the walking audit process that we use as part of this environmental assessment that Sonia was referring to before. So in 2016, Peel Public Health took an evidence-informed approach to the problem using what we call our process of end-to-end public health practice. As part of the approach, we conducted a literature review of neighborhood elements, both built and natural, that were associated with neighborhood walkability. The major themes that arose from that literature review included things like density, proximity to destinations, streetscape characteristics, sidewalks, land use, and nature. So in addition to the literature review, we also conducted an environmental scan of different walking audit tools that were already available to find one that would be most appropriate to the urban and suburban context in Peel. So we decided to adapt the new CSA tool and adapt it for the Peel urban-suburban context. We used sections that aligned with the literature review. So we used 7 different sections that had a variety of questions under each. The sections were around destinations, mix of destinations, street layout, walking experience, sidewalks, nature, and home. So you can see on the left-hand side there's an example of kind of what our walking audit tool score sheet looks like for one of our destination sections. And then at the bottom there you can see some examples of questions that we ask and how we ask them. So something like if you can please rate your agreement with the following statement. So this neighborhood is a safe place to walk for people of all ages. Participants would then indicate if they strongly agree with that statement, if they somewhat agree, somewhat disagree, or strongly disagree. So another example would be this neighborhood has sidewalks on both sides of the street. So after that, the scores are tallied up from the Walking Audit score sheet, and there's an overall score or walkability rating that's calculated for that neighborhood. In conjunction with the development of the tool, we actually created a Walking Audit Facilitator's Guide to help guide the process for how the tool could be implemented as part of a public health intervention. The guide outlines a step-by-step process for how to plan a walking audit, including who to include in your core planning team, how to select the neighborhood or the community, different logistics to consider, how to actually run the event, and how to evaluate it. Our Peel Public Health staff led the planning of the actual walking audit, but members of the core team are always closely involved. In this case of the EA, the core team included members of the EA project team, so Sonia as the project manager, and also Asha as the technical analyst. So as Sonia had previously mentioned, the EA already identified the neighborhood or the community that they wanted to do this within, and they had already had a community working group that was engaged in the process. So we were able to kind of leverage that group to actually conduct the walking audit, which worked really well with our walking audit and with the EA process. So in terms of how the actual walking audit takes place on the day of, it kind of goes in 2 sections. So our first section is the walkabout. So on the day of the environmental assessment, the group met at a central location in Caledon in a recreation center or community center. We have a community development worker from Peel that has expertise in community engagement and facilitation, and she was able to lead the group on a 1 to 2 kilometer facilitated walking route with some predetermined stops where we could really talk to the individuals about what they liked, what they didn't like, what they were seeing, and what they were experiencing. After the walkabout, the participants headed back to the meeting spot and were able to fill out the walking audit tool and kind of score that. So the second component of the walking audit is the charrette. So a charrette is an intensive planning session where citizens, designers, and other stakeholders collaborate on planning and design recommendations. So as part of this process, the participants engaged in a mapping exercise where they'd identify different aspects that they liked and that they didn't like on a large-scale map of the area. And then they'd be able to kind of engage in some small group discussion. After that, there was a larger facilitated discussion to discuss ideas and recommendations with the whole group. Finally, Peel Public Health was able to summarize the feedback and the walking audit scores and provide that in a report back to the EA project team. So in terms of some lessons learned, I'm just going to pass it back over to Sonia to talk about some specific lessons learned around this EA process, and then I'll talk a little bit more about some general lessons learned for the walking audits overall.
Thanks, Kale. Here are some lessons learned with respect to integrating walking audits into the EA process. First, as a result of our experience, we are now interested in developing criteria to determine when a walking audit is necessary for an environmental assessment. For example, a walking audit may be ideal for a road corridor project rather than a water or wastewater project, or even a site-specific intersection project. Secondly, when developing the terms of reference for future projects, we would like to consider when to conduct a walking audit during the process for meaningful input to the process. Ideally, walking audits could be held during phase 1 or 2 of the Class EA process to help understand community interests and needs at the onset, and for the opportunity to address concerns and issues as early in the process as possible. We would also like to develop criteria to enlist participation by a representative community group based on factors such as demographics, mobility, and interest. The Walking Audit for Airport Road leveraged the existing EA community working group. However, not all EAs will have a community working group, so how participants will be recruited for this purpose may need to be considered. As well, the community working group was established based on separate criteria after the Walking Audit tool, or before the Walking Audit tool was introduced. So as such, some representation was not available, such as school children, and so we did have regional staff in sustainable transportation join us and participate to ensure there was a range of perspectives represented. And finally, we suggest customizing the Walking Audit tool to align with the objectives of the environmental assessment. So for Airport Road, we removed a question related to speed because we thought it might be misleading to participants regarding the options available for speed reduction. For instance, asking participants whether traffic speed feels like 40 kilometers per hour may imply that a speed reduction to 40 kilometers per hour is an option that we are considering. And so now back to Kale.
Okay, thanks, Sonia. So just for a little bit of context as well, we have implemented a number of walking audits in the past, but this was our first one as part of the EA process. So those are some great lessons learned that we had from this process. And then just kind of in general, we also always recommend to engage appropriate stakeholders. So it's always really good to think about possible stakeholders to engage in each individual neighborhood. And this might take an individual approach. It might include regional or municipal representatives, principals, teachers, or students from nearby schools, business owners, and we've always had a lot of success with engaging counselors from the area as well. Also consider the season and the time of day. So think about the best time to hold a walking audit to make it accessible for those who you want to attend and that are representative of the community. So consider the time of day and potential barriers that people might face to participating, like childcare or hours of work or light if you're thinking of holding it in the winter. And these hours might not fit within our kind of typical 9 to 5 working day, but it's really important to be able to allow as much option for people to participate as possible. Also consider booking a backup day in case the weather is bad. And another idea that's come up in this EA and has come up in other walking audits as well is considering other options to allow people to engage in the process at different levels of engagement, or if they're not able to attend. So this could be offered in addition to the in-person components to allow for more people to participate and provide feedback. That might be an online version or another kind of survey that people can still provide their feedback but not necessarily have to participate in the actual event or the day of. So I think that concludes our presentation, and I will just pass it back over to Lorenzo to field some questions and to wrap it up.
Thank you, Kale, and thank you, Sonia, for that sort of informative walkthrough on our experience here in Peel Region, combining a more focused public health lens specifically on this particular road undertaking through the EA process. One of the things that I've personally been saying over the last few years is that public health, again, guided by evidence, are becoming a whole lot more sophisticated in their approach on these types of undertakings. I mean, the days of when, let's encourage walking and let's make it more walkable, I think now are leaving us behind, and we're moving to a position where we've got a whole lot more clarity and precision in terms of, what that built environment needs to look like to foster something as simple as more walking. So there is a chat box as part of the webinar platform. There's one first question here from Sue S. and Joanne is typing. I'm going to read out Sue's question. It sounds like getting public health involved from the beginning, input on the terms of reference, is key. How would you suggest going about getting this early engagement in the process if it hasn't happened in the past? And I'm going to make a quick comment, and then I'm going to pass it to Sonia and Kale to add more. The key on this is that you've noticed the word pilot that's been used a few times through this work. So I think that that's part of the lesson learned, is that you can't go from 0 to 100 real quick. You need a step in between, and I think this is where the pilot notion does help us. But I'll leave it to Cale and Sonia to give us some more input into that early engagement. What suggestions do you have for participants?
Okay,
Okay,
great question. Yeah, go ahead.
I can start from the angle of the terms of reference, and then if you wanted to add more. Just in terms of the terms of reference at the region of Peel, we have a process that's been in place for quite some time where whenever we begin an environmental assessment study or some type of project that's multidisciplinary, we pull together a project team, an internal project team, and always we have public health as a member of that project team. So that's sort of one way you could structure team input at the beginning of the project and when you're developing that terms of reference. And that same team is not only involved through the project, they are involved in either contributing or reviewing our terms of reference. And then the other thing I thought it may help to also just reach out to the different departments and let them know what your ideas are and what's to come and how you could work together. Because what I find at working at the Region of Peel is that there's a lot of support. My immediate supervisor is very well supportive of integrating active transportation and thinking about the health of the community. And she oftentimes will, or has in the past, from what I gather, discuss these terms with Lorenzo or Cale's immediate supervisor, and it just helps to keep the dialogue open, even if you don't have an active project in place. So in summary, it's about networking and opening up to people to ideas in how to work together, and then actually putting that into practice by inviting them and following up and ensuring that there's some participation on your project team.
Great, thanks, Sonia. And I'm just going to add to that as well a little bit. So I think that in addition to that, from the public health side of things, Peel Public Health and specifically our built environment team have done a really good job at building relationships between public health and the public works department and the planning and transportation planning and development planning. And I think that foundation of the relationship really helped to open up that conversation between our team and between the EA project teams. In addition, I think that it's really important for public health coming into it to start to find a way to get a better understanding of the planning process, which I think all of you are doing because you're on this webinar right now, and specifically the EA process, just to be able to understand what that process looks like and identify different opportunities within that process that the work that you're already doing will fit into what they're already doing, and even just being able to use the terminology and speak the same language that the planning departments do. I think that's really, really helpful.
Excellent. Thank you for that answer, Cale. We have another question here from Joanne. What were some of the key observations you can take away from the walking audit? Cale, looks like it's for you.
I think at this point we can't speak to any specifics about some of the recommendations from this particular environmental assessment just because it's still underway. But I can tell you in general that there's not usually one or two recommendations or ideas that come out of it. There's usually a list of a number of ideas and recommendations that go forward and help to inform the plan moving forward. So I don't think that there's necessarily one or two. It's kind of broadly around all those different areas and the elements that we discussed and that we talk about in the walking audit tool.
Okay. So, I mean, what the walking audit allows us to do, in the right stage at the EA, it allows us to, provide those insights into the design. And again, as Cale said, it's an element of our public engagement. And flowing from that, there's another question here from Dislava Stefanova. Is the community working, if the community working group represents a general population, does it represent the general population? How confident are you that the community working group is not biased. And I think there was part of that answer that Sonia provided by having other members, but I'll leave that to you and Sonia, to you and Cale to provide more insight into how do we ensure that the community working group is not biased when we're looking at the walking audit process.
So for the environmental assessment itself, when we established the community working group, we also wanted to do what we could to make sure that our community group wasn't biased for the EA, not just the walking audit. So it's a very good question because I think it can be challenging. The way we approached it is we had a set of criteria in the beginning, we had an open call for expressions of interest, and then we actually had a little bit of a selection process to be able to determine, who would have the interest, what type of group provides a cross-section of interest and can balance those interests when they're providing input to the EA. So we had although it's separate from the walking audit purpose, we did have, I guess, a set of criteria that we looked at in terms of determining who then sits on that group, and one of the objectives was so that we could get a cross-section of interest and hopefully not receive bias through, unintentionally through the group. I think there's a lesson learned here and an opportunity in future environmental assessments to look into that criteria further, and whether or not we establish a community working group, that we look carefully to how and who participates in the exercise, and that we make sure that in order to avoid bias, we have certain representation in place. So, we want people with all mobility levels to be able to tell us what the accessibility is like out there. We want people of different age groups because we have people who are going to work, who are driving, cycling, walking, but also going to school. And so we got all the age groups there. So how confident are we that the community working group is not biased? We're fairly confident because we have, tried to make sure that the selection process was done in an unbiased way. However, there's more room for improvement. So when we do conduct a walking audit for the next environmental assessment or for other purposes, I think that's where we're going to want to sit down at first and then determine what's our criteria, how do we reach out to a cross-section of people to participate on this walking audit.
Cale, do you have anything else to add?
Yeah, I'll just add something quickly. Just in terms of community engagement, there is always kind of that idea that the most engaged people, that in these 2 or 3 or 4 hour sessions, that you're typically getting the most engaged people in that community ever. So I think that it's really important to make extra efforts to make sure that your group is as representative as possible. It's never going to be perfect, but some things that we've kind of put in place to be able to do that is, for the first time as part of this EA, we're doing participant surveys as well so that we can get an idea of, how they thought the actual process worked, but also get an idea of the demographics so that over the course of the walking audits that we do, we can look at the different demographics and see how representative the participants were. In addition, it's also helpful to have that community working group in advance or know who's coming in advance. And then, as Sonia mentioned before, if there are gaps in terms of representation, you can attempt to kind of fill those gaps as needed. So if you notice that there's no one representing kind of schools, you can pull someone in to do that. And finally, I just wanted to mention too that one of the other things that we're looking at that I mentioned before around looking at alternative ways to engage people online or using different tiers of engagement, I think will be really helpful in getting a better representation because it will allow for different levels of engagement depending on what the availability is for different people. So I think this is really kind of lessons learned and a work in progress in terms of how we can best find and engage a representative group of the community, and we're always looking to improve that.
Excellent, thank you, Cale. And what I'll add also to that is that if anyone is familiar with the traditional approach on public engagement related to environmental assessments, typically there are public information centers that are held at strategic moments along the EA process. And, my hat goes off to the Transportation and Infrastructure Programming and Studies team at the Region of Peel for really broadening that public engagement approach to include some of the examples that we've been hearing this afternoon. So, it's really key that we depart from, your traditional public information centers and some of this work that we're doing on public engagement really gets at, the accurate design that we need for some of these facilities in the communities. Okay, another question here from Jane Holmes. Given the truck route going through a rural area, how do you balance that or align it with Vision Zero, the AT initiative aligning with Vision Zero? Any insights would be appreciated. Maybe Sonia, if you've got something to share with us on that.
Sure. The study area is actually quite a length. It's 7.5 kilometers. So it encompasses both urban and a settlement area, rural and a settlement area. So one of the challenges of this project is, in fact, the fact that we have a goods movement corridor, a truck route, that goes through a couple of communities. And the community of Caledon East in particular is a small community where there is a lot of pedestrian activity. There could be more cycling activity. There's businesses and shops and things like that. So we have a little bit of a challenge in terms of the use through that corridor. How do we work everything together or plan so that all uses can travel through that corridor safely and with comfort and convenience? So there is a section in that study area that is a settlement area. It's still a truck route. However, in order to help with things like Vision Zero and trying to, avoid the potential for safety concerns and conflicts and accidents, we're looking at ways of slowing truck traffic, so some traffic calming measures, for example, urbanizing the area or adding roundabouts at certain intersections. For Caledon East in particular, the active transportation that we're looking at is being evaluated based on, is there separation between the uses? So, for example, do we prefer a shared multi-use trail with pedestrians and cyclists over a bike lane, which is essentially on road right next to the travel lane, which could, be traveled upon by cars or trucks. So I think if this helps with your question, I think the idea is that we're trying to align it with Vision Zero and the idea of avoiding safety concerns by planning the active transportation infrastructure in such a way that it provides that buffer and that I guess the separation from motorists and vehicles and trucks. And we're also looking at the truck traffic in a way by looking at ways to calm or slow down the traffic, not necessarily reduce the speed limit, but adding lay-by parking and things like that in the community, adding gateway features, entering the community, so that way truck traffic and all traffic on the road know that they're entering a more, I guess, residential or commercial area, and that there are people and cyclists in the area, and that they slow down to travel through that portion.
Great. Yeah, those design cues for motorists, truck drivers, and others are absolutely vital. And I think that's how you can start to align the AT support that you're trying to provide and balance it out with the needs of truck movements and so on, while also moving towards Vision Zero aspirations. Okay, thank you for that. We have another question here from Shira Freeman. In addition to networking and relationship building, do planning and public health professionals undergo formal training and methods for including health assessments in EAs? Example, health impact assessment. Kale, do you want to take this? You're working on your Master's of Public Health. Is this something that you've been studying?
I was actually thinking Mikey might be able to best address this. Mikey, are you on the line? Can you?
Hi there. I am on the line. So I can certainly speak to this a little bit. From my experience with the health impact assessment process, a lot of it happens in the sort of academic public health environment. And I think there has been movement more recently to find opportunities to streamline health impact assessment, so it's applicable in the context of these projects that are happening quite quickly. So in terms of formal training and methods for health impact assessment, I've seen a few examples of short-term training. Actually, Lorenzo, maybe you could also speak, because I know you have a lot of interest in this kind of tool. You could speak to some trainings that you might know of specifically.
Yeah, okay, thanks, Mikey. Yeah, so I mean, in short answer on this, I don't think that health impact assessment is necessarily being included in curriculum, but I mean, please correct us if we're wrong on that. One of the things that the OPHA has done with the support of the Built Environment Work Group and of course the Ontario Professional Planners Institute is that there's an online training module that's been developed, health and planning working together, that 101 tool. So I encourage you to delve into that and get others to take that training. From the health impact assessment standpoint, I think that there's a desire to move in this direction. I think that the OPHA Built Environment Work Group, we've got this fully on our radar, and we're going to continue to move on that. And there are some suggestions that are coming to us for additional online courses and so on to get more insights into something as specific as health impact assessment. So with that, our time is starting to draw to a close. One of the things that I would like to say is that, and this has been brought to our attention from the OPHA, is that David Suzuki has a new TV show on air quality, outdoor air quality related to traffic that this group on the call today may find interesting, and you can find that on the Nature of Things. And so with that, we're essentially out of time for today's webinar. Many thanks again to Sonia and Cale and Mikey from Peel Region for their informative presentations, and to all of you for participating, asking questions, and we encourage you to continue, or in some cases, maybe start the dialogue between public health and public works. There were some questions on there, when's the right time to engage, and I think that, making introductions between public health and public works, engineering, and so on is important, because I think there's a great awareness around needed change. I think we're starting to build the desire for that change, and things like this start to provide us the knowledge that we need as well. Special thanks to Candice Acquia, as well as Calden Lama at the OPHA for all the technical support to get the webinar coordinated and presented today. And the next and final webinar in this series will be happening later this year, not too long from now, and a notice will be posted on the OPHA website. Keep an eye out for an email on that as well. And finally, a reminder to please complete the webinar evaluation survey. A link to the survey along with the webinar recording and presentation will be emailed to you early next week or even sooner. And also the other presentations, the other webinars that were hosted in this series are available online as well. And with that, I'm going to say thank you again and enjoy the rest of your day. Thank you.